The main lesson we've learned is that we have to do a much better job of getting ready, not only to help the people who need medical help, but also to help and support the people who are providing care. You can put this under the heading resilience or preparedness or lots of other words.
Protocols, I think, are going to be very important for the future. There are protocols for terrorist attacks, for instance. There should be protocols for pandemics.
The people who work in these jobs are doing essential work, and we should probably review how they get compensated. There's been just way too much attention to costs and not enough to livelihood and quality of life for these people.
Sweden, for example, has a much bigger public sector that includes health workers, and they are better compensated in relative terms than in other economies. Now, of course, if we go down that way, we have to realize that it's not a free lunch. When you have spending on one side, you need to put revenue on the other side. The question then is whether society is prepared to pay the higher taxes to compensate frontline workers. There still is constant gratitude being shown, but does it make those good jobs in the longer term? I doubt it. You want to see something much more concrete in normal situations.
The US can't get its act together and actually provide healthcare for everybody for a reasonable expense. The healthcare system tied to employers, you have to get rid of that and replace it with transportable healthcare so that people can move around and get new jobs and get many jobs at the same time. I think this will be a big push for universal health insurance and healthcare in the US.
When government needs to save money, what's the easiest spending to cut? Now, the first one that gets cut down usually is the public investment. And unfortunately, health comes under public investment in many instances.
I think technology is the answer to one of the biggest problems for the developed world, which is the aging population like me. I think the robots are going to hold the solution. As we have seen, for instance, in Japan. Japan is a real harbinger for what's to come.
There will be an increase in the demand for health services even without COVID. Even if we find a vaccine and then we forget about it, there will be an increase in demand. And you cannot just do it all quickly and suddenly.
Fear has to be removed in order for economic activity to pick up again. Vaccines may help, but they don't necessarily remove the fear. What we need is some better treatment that would take, say, death out of the picture.
You know, we're not that far away from a world in which everybody's going to have pre-existing conditions because they're going to study our genetic sequences and discover that you're vulnerable to this and I'm vulnerable to that. If you turn that loose in the private sector, then you'll get just chaos in terms of differential pricing for people being denied certain kinds of health insurance or care and so on. And it seems to me the only way to avoid that is to say we're not going to go down that road. We're going to have universal health care. Universal health care is essential, you know, should something like this happen again, and most people think it will.